everyone, this is Paul from Ortho Eval Pal, and today I want to demonstrate how to do median nerve gliding and sliding exercises. Now, the first thing you need to remember about nerve gliding activities is that you need to be very gentle with them. Trying to push through it is not going to be helpful, okay? So it has to be nice, gentle, and slow. So let me explain why you need to do nerve gliding activities. There are many people out there who have an injury to the shoulder. Maybe they were immobilized in a sling, they had shoulder surgery, or maybe even a frozen shoulder. And because they're not using that arm, the nerves in the arm are not sliding and gliding very well. So what can happen is the nerve can get stuck amongst the soft tissue and not work like a muscle does. A muscle is more like an elastic. A nerve is more plastic-like fibers. And so what happens is if it gets stuck, it gets pulled on, and that can cause a sharp pain going down the arm. It could cause some tingling down into the hand, and it could mimic things like a nerve root compression in the neck, or it could mimic like carpal tunnel syndrome. So one of the ways we help to improve that nerve mobility is to try to make it slide amongst the soft tissues a little bit. Okay? So the way we do the median nerve glide is we start with the shoulders level across like this. Then you reach down with the affected side like you're reaching for your foot. Then you take the palm of the hand and make it face the floor and make the fingers go back a little bit. Okay? While the arm is depressed and the hand is down, you take the arm out to the side, and you're going to feel this cord-like, maybe even a sharp, shocking type of discomfort going down the arm. You're going to stop when you get to that point, okay? And I want you to think about that before you do some of these exercises so you can see how high you were able to get your arm. Once you've gotten to that point, then what you're going to do is you're going to bring the hand toward you and tilt the head away. And then you're going to tilt the head toward that arm while you bring the hand back again. And you're going to do that 5 times, okay? And basically allow that median nerve to slide and glide amongst the soft tissues. After 5 repetitions, I usually just shake it out a little bit, take a break, and then I start that process over again, okay? So you would do that 3 sets, and then once you are done, test yourself again. So drop the arm, bring the hand back, while your head is straight, bring the arm out to the side and see if you can get a little bit higher this time. And most people do it. It's pretty amazing once you start to get that nerve gliding better, how that starts to allow your arm to function and even have a little bit less pain and tingling in it. So I hope you liked our video. Make sure that you give us a thumbs up and subscribe to our channel. And if you have any comments, just leave your question in the comment section down below, and I'd be more than happy to try to answer it for you. Thanks for watching.